Hey guys, welcome to another video. Today we'll be covering Amoebiasis, and hopefully today's audio quality is better than the previous video. I'm working on that. Okay, so for Amoebiasis, the causative agent is Entamoeba histolytica, and the spread is by orophycal route. It's basically the cyst enters the GIT and damages the cells, and the form of Entamoeba that goes inside our body is trophozoite phase. Initially, it's asymptomatic when the cyst is in the colon, then it converts into the trophozoite, which invades the muscles in the colon itself. And that's when you see a characteristic flask shaped ulcer in the colon, and then it ultimately invades into the liver. When the cyst is in the colon, it's asymptomatic and it's called luminal amoebiasis. And if you kill this cyst, then those agents are called luminal amoebicidal agents. And your drug of choice for that is paromomycin. We'll get on to the drugs in a bit. For the other phase, the second phase, when it invades the muscles, it's called amoebic dysentery, and at that time you see bleeding as well as abdominal pain. And ultimately, when it invades the liver, it's called amoebic liver abscess, and it's a generalized symptom of increase in WBC, fever, and tenderness of your liver. This second and third phase is known as your invasive or tissue amoebiasis, since now the infective parasite has entered your tissues. And therefore, obviously, the agents will be called as tissue amoebicidal agents. And your drug of choice for that is metronidazole. You probably might have heard of this. Okay, for luminal amoebicidal agents, now we'll get on to the drugs. You have paromomycin, you have diloxanide, furoate, you have quinidochlor, you have iodoquinol. These two drugs are not used nowadays, so even if you don't remember, it doesn't matter. It's just for classification. They have a severe side effect called as SMON. Your tissue amoebicidal drug of choice is metronidazole. You get chloroquine, which is added in case of liver abscess, and your other drug that you use is emmetine. Now, talking individually for your luminal amoebicidal agents, that is when this is over here and when the cyst is still in the colon and has not penetrated the tissues. Your drug of choice is paromomycin, and it's an oral drug, and it's also classified as an aminoglycoside. That is your drug of choice. Moving on to the next one, it's called diloxide furoate, and this is your second choice. The furoate is actually an active moiety that kills the entamoeba, and the side effect you see with this is flatulence. Flatulence is nothing but accumulation of gas in the fundus of your stomach. Third drug, quinidochlor, you really don't need to know. The side effect, as I said earlier, is SMON, and it's called subacute myelooptic neuritis. Iodoquinol has the similar side effect. These both belong to the same category of drug, and the side effect with this is thyroid abnormalities and as well as allergies, which further causes angioedema. For your tissue amoebicidal, your drug of choice is metronidazole, and some other drugs that are added to it are tenidazole and nonidazole. It's your drug of choice for amoebic dysentery, where you are given 400 mg 3 times a day for 7 days. In cases of amoebic liver abscess, you give 800 mg 3 times a day and for 10 days. So the drug dosage becomes double. This remains the same 3 times a day, that is TID. And for 7 days, it becomes 10 days because liver abscess is a more severe form. And you also add luminal amoebicidal agents and in both the cases, and you can also add chloroquine, which kills the hepatic abscess. It's commonly used drug, it's called emmetine, and it's a protein synthesis inhibitor inside the pathogen. It is given as an injectable form, and its side effects causes emesis, that is nothing but vomiting, and it's also cardiotoxic. This brings us to the end of amoebiasis.